Hello. Hi.
Yeah, how are
So
you?
nice to have you on. So nice to see your faces. I'm good.
Very good, thank you.
Thank you. Good. So it's very exciting to have you on board the directory and to be doing this live with you. Oh no, of course, it's my pleasure. You were two of the first people I thought of because like I've known you guys forever. I think I met Claire through Casey. I was introduced to you. Yeah. Casey is somebody else who's on the directory, and she owns a lovely business called Sensoryland, and they do baby massage and so forth. She is amazing, as are you both. I had a couple of massages with you. And I thought they were amazing, and then we did some CBT work for my daughter.
Cranio with her, around sleep and stuff.
Yeah. Sorry, not CBT.
I don't do CBT. Just so we're clear. Not yet.
Let's be clear. And then I think I learned about you.
I think we met ages and ages ago in the pub. We went for a meeting once, a long time ago.
Yeah, just up the road.
Did we?
Yeah.
Oh wow.
It was a long time ago.
Years ago. Fantastic. So I just wanted to start by giving everybody who's here a little bit of background about each of you. So could you give us a little intro to what you both do?
Claire King of Claire King Therapies. And so I am a craniosacral therapist. I do have a massage background, but my work is predominantly craniosacral therapy now, otherwise known as CST, because it's quite a mouthful. So it's a really gentle treatment with its roots in osteopathy, and it's really restorative, and it works on the whole body, and particularly on the central nervous system. Because it's so gentle, it's really great for babies. I see lots of babies. My youngest baby, I think, has been about 4 days old, and currently my eldest lovely client is in her 90s. So it really, it really is great for all walks.
Big age range.
It works to really restore and relax the body, to remove tension, and as I said, it works on the central nervous system, the musculoskeletal system, and also the fascia as well, which is this amazing connective tissue that runs throughout the whole body. So it's really calming on the whole body as well, helps the body just work better. It's also, remedial, so it looks to address any issues that might be there and just have a lovely kind of calming effect.
Okay. It's really nice to know that you could, like, the youngest client you have is 4 days old, because you find a lot of the time with therapies is that you have to wait a certain amount of time before babies can have treatment.
The sooner the better. The sooner the better. Yeah. There are, some midwives that are also craniosacral therapists. So so it can be just instant.
Okay.
That would be a great
thing. Amazing.
So I'm Hannah, and I'm an acupuncturist, and I'm actually a fertility awareness teacher trainer, and I've been in practice for 10 years, and over the years I've kind of honed my specialism. So I am a fertility specialist, and I really support lots of people going through fertility issues. So whether they're going through IVF, whether they're trying to get pregnant naturally, early stages of pregnancy, we're doing a lot of support, because obviously lots of people have been through quite a difficult journey to get to that point, and there's a lot of anxiety, so we do lots of early pregnancy support. And I work a lot with the menstrual cycle, and just kind of like you're teaching people about how to understand their cycle to maximize their fertility, and to kind of sort of do a lot of work around raising awareness of what a normal cycle should look like, because often there is a lot of not misinformation, but we haven't really been given that education, so people can assume that a painful period is normal and there's not a lot that they can do about it, and it's a question of going on the pill or putting up with it. So I really bang the drum for the different ways that you can resolve a painful period or whatever the issue is, and how that really informs your fertility and your fertility health. So that's what I do.
That's incredible. incredible. I had no idea that your practice focused on the menstrual cycle as well, because that's something that I eventually want to go into with like the second line of teas and stuff. And it, like you said, it's so important. Like, it's something that we all go through as women, but the education around it just, I feel like it's very few and far in between. Like, and it's obviously it's something that we should all know about, but it's just opening up those conversations. I feel like sometimes because these things just happen to us and it's month to month, it's just like we go through it and we just accept the way it happens, and it's everybody's going through the same thing, and we don't have these conversations to say, oh no, actually this isn't not necessarily normal and you can do something about this. And so that's wonderful. That's wonderful. I'm learning as well. So what is the story behind your journey into both of your prospective treatments? So like your journey into CST and your journey into acupuncture. Is it a personal story?
For me, yeah, a bit. I mean, I've been a massage therapist since 2003, so nearly 20 years. Yeah, so I've done, I've done all the courses, and then I trained to be a baby massage instructor as well. And I absolutely love doing massage. I really love doing it. But I'd had, 2 kids along the way, and I was just kind of thinking about the longevity of my career. And massage can be, well, it is really physical. And so I was aware of craniosacral just through the journey through with my 2 kids. And I kind of started thinking about other things that I could do. And then I just had this light bulb moment where I thought, oh, yes, I can do that. And I kind of looked into the course, and it worked around my family, and it was 2 years. And I thought, yeah, it's time. I'd spent a long time training, but back in, nearly 20 years ago. And I thought, right, I'm ready now. I'm ready to kind of get my brain into something. And yeah, that was my kind of, journey into craniosacral.
And did you use craniosacral therapy with your children? Did you?
Yeah, I did. My firstborn, he was fine. I took him for a check and he was all right. But my secondborn, she had a really, really tough time. And actually, it really helped both of us. Yeah, she was very poorly. We had quite a bad birth experience. And but I mean, she's totally fine now. And it was brilliant. And it really, it really, really supported us and really helped us.
Oh, good. I love the fact that you have like a personal connection to your journey into it. I think it's so important to kind of do what you do with authenticity, especially when you're working with mothers and newborns and so forth. It's really key. So I love hearing the stories behind people's journey.
Well, I first had acupuncture when I was pregnant with my daughter, who's now 17. And I wanted to have a home birth, and they wanted to induce me on my due date because there was some issue about my placenta. And somebody said to me, go and try some acupuncture, it can be really good for bringing on labour. So I went and had 3 sessions of acupuncture with Emma Cannon, who's a really famous acupuncturist. She's written a lot of books about fertility. She really sort of drove the way for fertility and acupuncture, and I had 3 sessions with her, and I went into labour on my due date and had a really straightforward, no complications, really great birth. So I was really sort of, my eyes were sort of awoken to the power of something, because I didn't know what had happened, but something had clearly happened, and it was a really positive experience. So I had acupuncture from then on, really, and retrained when I had my second. I went back and retrained then. So when my children were small is when I did my training, and then I built my business up. As my children have grown, my business has grown, because they get less demanding, so I've got more time to concentrate on work.
You got more time. Oh, that's wonderful. Lovely. Okay, so why was it important to you both to specialise in issues of fertility and childbirth individually, and again for SCC, Streatham Community Clinic?
Well, I think, I touched on it, childbirth and beyond. I think it's my personal story that, with my my daughter, that actually kind of inspired me. Once I finished my training, I just you know, I did some more training then. I'm constantly doing trainings, but yeah, I did some more training in working with mothers and babies, and I just loved it. I just absolutely loved it. And then just knowing how fragile I was and my daughter was, and how it helped both of us. I think it just felt like a really, it felt like it fit, you know, it was a natural fit for me. And then babies just kept coming, and yeah, it kind of took off like that. And I just have a real kind of passion for it, just for supporting mums, and you know, parents and babies, and just particularly when they've had, you know, some trauma that's happened at birth as well, you know, assisted deliveries and things that, you know, haven't quite gone according to your plan, and just offering that support and that help and advice and treatment for baby and for parent as well.
Fantastic. And can you tell us some more about SCC, Streatham Community Clinic? Like, how did it come to be? Why did you feel it was important to give back?
Well, I mean, really, Claire and I have worked together because we're neighbours, we're friends, we've got children at the same school, so we've worked together and collaborated actually quite often over the years, whether it's sharing clients or just, you know, the conversations. We're sort of in the same field and the same network, and so we've often talked about doing something. Well, I think it was really the pandemic. We started,
didn't we? Then
we started doing courses on, you know, like inductions for labour, and using massage and acupressure to sort of help when you go into labour and the period before labour, to sort of encourage labour to start. So we did some online courses because we had basically nothing else to do, because we got shut down our businesses. And then when, you know, just as a part of the pandemic, we sort of just felt like we wanted to do something to kind of help support people, because people have been through a difficult time. We know that, you know, people lost jobs, the economy is kind of, you know, really suffering. And so we were really keen to be able to do something to help people who couldn't usually access our therapies, because the thing about being a therapist is it's the best job in the world. But, you know, if you believe in kind of, you know, treating everybody, unfortunately, it's not available on the NHS. And so therefore it's not accessible to everybody. And so that is the, you know, it's the only thing about the work that I find difficult to sit with. So this was kind of something that I think we've both thought about for a long time. We're both at points in our career where, you know, as therapists, we earn enough money to be able to give up a day every other week and, you know, work in this way. So
and it was a bit of a, you know, a moment, wasn't it, where I was like, oh, I've been thinking about this idea, and he was just like, yeah, let's do it, let's get it going. It took a little while, because obviously there was a bit of, you know, stop starting and lockdowns and things, but
Incredible. When I heard about what you were doing, I truly just thought it was wonderful, because what you do is so key, and the visibility of what you do is so important to kind of changing the whole experience of fertility, childbirth, menstrual cycles. Because like you said, I feel like the education around what you do and alternative therapies just isn't there. So the fact that you're making it more affordable within your local community is just, I think it's just so, it's so important to getting people to realize that this is accessible, and it is something that they can participate in, and that it's issues that they can get help with if they don't necessarily want to go down the NHS route. So I think it's wonderful, and the fact that you're starting with Streatham might migrate to other areas, who knows. I think it's really lovely that you're just giving back to your local community.
It feels good, doesn't it? It feels really right, and it feels like we've done 2 now? We've done 2 now. So we've got the 3rd one on Monday, the clinic, and it's just like a great atmosphere, and it's just like a lovely space that we're in, and it just feels right, and it flows, and it's just it's been really good so far, and we've had a great response.
And how are people finding you?
Instagram, Facebook, local message boards. We've sort of gone. I think we're in the Streatham Heart magazine this week or this month, hopefully. I've not seen it yet, but yeah, and word of mouth really. I mean, to be honest, we've been up and running for a month, and we're pretty much filling up straight away now. So the first couple of times we had some spaces, and now because people book in, and then, you know, the thing about treatment is like that continuity of care. You know, you get the best results when you see people on a regular basis, and that's what's great about it being affordable, is that you can have that regularity in your treatment. So people now book in, like I had somebody book in the other day, and she booked like eight weeks worth of sessions. And so, and that's great as a practitioner, because you get that consistency of working with someone. You work with them through their menstrual cycle, you can see how they respond at different times, and so, you know, I think it's sort of grown quite quickly, actually. So
and I think also we've been very clear with the message about come and give it a go, come and try it, and try both, not on the same day, so it'd be a bit much for you, but come and try both and see what you think, and please book again, and book in for if you want, you know, just really kind of opening and just trying to make it even more accessible, you know, just come and give it a go.
Of course, I think that's the whole attitude that we need to have around therapies like yours. Just be open-minded and try, because I feel like we're so kind of, not that I've got anything against like westernized versions of medicines and health and so forth, but I feel like we're so dialed into that, a lot of us, a lot of the time, that the thought of going outside of that just isn't an option, because that's kind of what we've been brought up to believe. You go to your GP to get this help, that's the way it goes, and the thought of doing anything outside of that might seem a bit hippie-ish, or oh no, I don't want to embark on that. But it's just about changing attitudes around health and really tapping into the holistic elements, and just letting people know there are other
come
ways.
and lie down on a nice warm couch and have a blanket on you, and, you know, come and feel better. Come and feel better.
Exactly. Who doesn't want that?
Also, people often come to us when they're at their last resort. You know, they've tried. People often, you know, access alternative therapies or complementary therapies when they've tried everything else. And so, you know, I really try and get the message out there, like, don't wait till you're desperate and things have progressed so bad and you've tried everything, like, you know, because what's brilliant is if you can use all medicine integrated together, because that's what I always say to the people that I work with, that, you know, it's about looking at your diet, it's about looking at your lifestyle, it's about a combination of things, because not one thing is ever going to be the thing that fixes or, you know, helps you get better. It's usually a multiple pronged approach to wellness that people really need to take if they want to have long-term health. Otherwise, it's a sticking plaster, and, you know, you might feel better for a few days, and then what happens is that the symptoms return. So it's about, you know, a lot of it is around working together to kind of come up with a new plan of, you know, doing things in a different way sometimes.
And I think it's very much what you said earlier, Hannah, about the continuity of care. That is so key as well, having that time, building that rapport, getting a greater understanding, because I feel a lot of times people might try something, like you said, as a last resort, or they'll try it and they won't necessarily come back to be able to see what the benefits could be. So it's just getting people to understand that this is a process. And one session isn't going to do it. You kind of have to be committed to it, you know, and truly give it a chance and be a bit more invested. So that's really key. Sorry, just reading my questions. I think we pretty much answered this question, but we can elaborate a little bit more. Why is it important to you both to change such narratives around holistic therapies or complementary therapies and opening them up to a wider community?
I think just, I mean, like you said, what we've covered really, just really making it accessible for people. I think. Do
you see this going further than Streatham, possibly, if it does well? Is it something you'd like to?
I think it would be great to, you know, the problem is finding the space. You know, finding spaces that work for this setting, that is the problem, and finding somewhere that's in a community that's affordable, that's not expensive, that people can access. That actually is the biggest challenge.
Our biggest task.
It took a long time, and Claire's very hard work and perseverance, I have to say, to find us the space that, because, you know, we tried various different ones and it was either too expensive, so we just couldn't make it work, or it wasn't right, or they didn't get back to us. So really that is the biggest barrier, I think, is the space.
Yeah.
But, you know, if we can find them, then we'll do it.
Yeah. Definitely opportunity to grow.
Amazing.
Yeah. Healthcare's not going to get any better over the next 5 years.
Definitely.
It's actually, you know, we're in a crisis, and people are in a crisis who, you know, obviously need to access for various different reasons. Not even, you know, people could just come to see us for stress or anxiety, and we would definitely, both of us in different ways, be able to help. So, you know, there's a lot of trauma and anxiety and stress out there at the moment, and people are not getting care because there's waiting lists. So, you know, there is a real demand for what we offer. It's just a question of how we can deliver it and where we can find a space to do it.
Fantastic. So I know, Hannah, you said that you specialize in fertility, but you also cover like menstrual cycles and so forth. You just mentioned that you work with clients on stress and anxiety as well. Can you talk yourself and Claire talk us through a little bit more of the other kind of conditions, the type of patients you see day in, day out, and what their requirements are? Just to give us a greater idea of the kind of things.
I mean, the vast majority of mine are people who are going through fertility treatment. So I see a lot of people going through IVF. So that's you know, in my private clinics, that's a big part of what we do. And we see some people for menstrual cycles. So we see a lot of endometriosis. We see polycystic ovaries. So not necessarily people coming for fertility treatment, but, you know, they might be in their 20s or 30s and are trying to get their cycles right. So that's another thing that we see a lot. And, you know, in my private clinic, we have a reflexologist and a Chinese herbalist as well. So we have like a multi-pronged approach where we, you know, someone might see us for herbs, and they might see us for acupuncture, they might see us for reflexology. And actually in the Streatham Community Clinic, they have been the same people that I've seen. So I've seen endometriosis. Sorry?
Oh, amazing.
Oh, yeah.
Sorry, I just said that's amazing.
People who, you know, wanted to come and see me or see one of my colleagues in private practice, but haven't been able to. But so I've seen endometriosis, polycystic ovaries, somebody coming for IVF support, somebody coming for natural fertility. She recently sadly miscarried and wants to kind of get her cycle back and wants to start tracking her cycle and sort of work on her stress around getting pregnant. So, you know, it's a really great extension of what I do anyway. So it's good.
Incredible. And Claire, what are some of the types of
lots and lots?
I'd
say, you know, we see a lot of parent and baby sessions, and I do a lot of long-standing pain, actually, so unresolved pain. So when it's just, you know, it's obviously really frustrating to be in a lot of pain. So I see a lot of work with a lot of pain, and also anxiety, tinnitus. I've seen quite a lot of long COVID patients as well, that presents quite often with tinnitus and migraines. So a very varied, I would say, very varied.
Okay, incredible.
Right. I think we have.
We've pretty much covered everything. Yeah, I think we have. This has been absolutely wonderful. Would you like to just tell us some more information about the actual clinic, the clinic days, the clinic times?
Yeah, so it's Mondays.
How people can book in.
And just in term time at the moment. So we've got 2 Mondays in March. So we've got this Monday coming, which is the 7th, and then we've got the 21st. And then we've got a bit of a break, but all the dates are obviously on our website. So you can go over to our Instagram page, click on our bio. It's got the website that takes you straight through to the booking link, and you can book and you pay at the time of booking. So no money changes hands in the clinic, which is a really nice kind of way of working for everybody. And you choose what you pay, starting at £30. And yeah, I think that's and it's at the living room place, which is just in Fursdown, so it's quite central between Tooting and Streatham, and obviously it's in Fursdown as well, so it's quite accessible, and free parking is always good. Always good in London.
Always a good thing. Well, no, thank you, ladies. It's been lovely to have you on, and I love everything about what you're doing. I think it's so incredibly important, not just the visibility aspect, but just the fact that you're doing it within your community. I think honestly do think it's wonderful, and I can see this spreading to other communities, other areas, other boroughs, and I think it's going to be incredible. And I hope with this live, with the blog post that will be on the directory tomorrow, that we are helping to provide that visibility for what you're doing, but also that we're helping to, that we're just helping to change the narrative around what you do. And instead of what you do being considered a last resort, let's think of it alongside the first resorts, you know. Like you said, there's something systematic that you can incorporate into all the other aspects of your lifestyle, diet, health, looking at all the issues that need sorting, and
just self-care,
just giving people that self-care, and just providing people with that education to make the right decisions around their health. So
thank you.
Thank you very much this evening. No, of course, it's my pleasure. And everybody who's watching, they are up on the directory now as we speak, which you can access through my bio on my Instagram page, or through the website mothernaturесrecipes.com/directory. And their blog post will be up on the directory and the blog tomorrow, just giving you some more information about what they do.
Thank you
so much, ladies. It's been a pleasure.
Bye.
Take care. You too. Bye.